All right, we're going to continue and head back into the Zoom room where we have another doctor, Dr. Kelly Neal, who joins us every Tuesday. She's from the American Medical Clinic, and it's our segment, our weekly segment, Here's to Your Health. Good morning, Dr. Neal.
Good morning.
And let me just pull this up. So what do you have for us this week, Dr. Neal?
Well, as you know, it's been 2 weeks. 2 weeks we started a segment on the annual wellness. So in kind of just hijacking right on that, this last segment is the care coordination. So last week we talked about the PULSE, which is the Physician's Order for Life-Sustaining Treatment, which is also talked about in the annual wellness. Now, the annual wellness is a Medicare initiative that I discuss once a year. That is a Medicare mandate. We go over a lot of things, including kind of the depression scale and are you smoking and how can we stop, and many, many things. So we do that once a year, as well as the decision for life-sustaining treatment. We discussed that last week. And then thirdly, what we're going to discuss today is care coordination. So Medicare pays for a care manager to call the patient once a month, and they will say, hey, how are you doing, Mrs. Smith? Is there anything your provider can do for you? Are you about to run out of medications? Did you have any medication reaction? Anything you want to talk about? They're going to talk to the patient once a month to make sure that that Medicare patient has everything that they need. God forbid, do they fall? Do they need any physical therapy? That type of thing. So you think kind of once a month is a little bit over the top, but to be honest, for these tender folks, it isn't enough. The unfortunate thing is so often they look so forward to somebody calling them. It's like a grandma. It's like one of my grandkids calling. And sometimes the care managers can't get them off the phone. So it's a really nice benefit that for these Medicare patients to get this phone call. With my team, we keep an electronic platform that's actually attached to Medicare, and then they message me anything that the patients may need. So it's a complete 360. The care managers call Mrs. Smith. Then if Mrs. Smith has any concerns, they message me. I answer them. They give them right a phone call back. And we really keep a tightened up base on any of these patients' needs, and we take care of it in a really good, timely fashion. So that's the beautiful thing about care coordination. That gets initiated traditionally at the annual wellness visit. That's what care coordination is. They have to have what they call two chronic conditions, which means it's not going away. Well, all of us over the age of 40 usually have arthritis, so that's one. We all go in good company. And it could be hypertension, it could be diabetes, it could be sleep apnea. So the second one is usually not hard to find. So you have to, by Medicare standards, at least have the second one, and then you're in like Flint. That's it. That's the care coordination. That's how you qualify. You have to have two or more.
Okay, so qualifying for that, it's not just on Medicare and then you get this call every month.
Yeah, that's it. You have to have two care coordinations, and you have to be activated. So that activation is usually hijacked off of the annual wellness, which we talked about 2 weeks ago. So that annual wellness is a lot of work that we do once a year, and then that's the ripple effect. Is that what we do is to make sure that and so the care coordination is activated on the annual wellness, and then as long as I see them once a year, that can continue, because it's usually I don't have to be the primary care, which is not necessarily a bad thing, but I want to see them once a year to kind of keep the methodology is to kind of keep that going, because it is a benefit of Medicare.
That's the thing that we talked about. We actually met last week and went over that, all this stuff. And it's a lot of information. I didn't realize before going on Medicare that just how much is out there, how much information, how many benefits there are for people that have these conditions. So sometimes I just assume that you get Medicare, okay, I saw my doctor, I'm on Medicare, whatever, I'll just but you kind of have to keep up the pace and make use of these benefits, really.
You have to keep it going. It's kind of like maintenance, in the car type of philosophy again. You got to keep it up.
So for those that are new to Medicare, myself included, that first wellness check, that's the good foundation to figure out where we are. And again, you mentioned it to me and to the audience here that you don't necessarily have to be the primary physician. You're just kind of there to navigate through all these other Medicare issues.
Correct. So remember, and I don't mean to say this disrespectful, Medicare is not set up to care about the patient. They're never will. The Medicare gives that over to the providers. They say, hey, we're going to take care of the money. Okay. Right or wrong, we're going to take care of the money. They say, you as the provider, you take care of the patient. And so we're incentivized, AMC is incentivized, you got to take care of the patient. From the health standpoint, we're taking, so this care coordination is a great thing because their goal is to keep them out of the hospital. So the patient, let's say, for argument's sake, you have the phone number to your care coordination, your care provider or your case manager saying, okay, your case manager, let's say, for argument's sake, is Susie. So if you need medications, you call Susie, say, you know what, Susie, I'm really running low on my aspirin. They say, hey, no problem. I'll run a message to your provider. I get the message, no problem. I will send it right over to Kmart. And it's to make sure that you don't have a clot that will run you into the hospital, that because as soon as you walk through that hospital bay, it is a minimum of $18,000 because the hospital is incentivized to run up to make sure nothing bad is going on. So even AMC, we have a walk-in clinic to make sure that, God forbid, you twist your ankle, let's take care of it. If you're short of breath, okay, let's take care of it. Now you go skiing and break your ankle, go to the hospital. We're not going to necessarily fix the ankle in a clinic because let's call it. But if it's something that can be happening, we want to take care of it in the clinic situation. Does that make sense?
It absolutely makes sense. Preventative maintenance, you know, just like you would service your car. You would service your car before it breaks down, and then you've got this huge bill. If you just maintain it regularly, it'll last for miles and miles and miles. And that's what you're trying to do with Medicare patients.
Absolutely. Which we, to be honest, maybe we didn't do well decades ago, but we're turning that face and turning that side around to make sure, hey, this is what we now really want to be known for. And to take care of, you know, the car that wants to keep running. It's like Toyota, really. You know, I think to the ground. I'm a big advocate for Toyota. We can really run those down to the ground. So that's a good thing.
Okay, it is a good thing. And anyone on Medicare, if they have not had their wellness check, their annual in a while, or if they haven't, gotten in contact with their case manager, it's never too late to do so.
No, I agree. I had that number memorized. Well, not really. Do you want me to give it to you again?
You're not going to give us your mother's number again?
Okay. Oh my goodness, I got in big letters. Okay, that number is 648-9110.
All right, so call it, that preventative maintenance again. There are the benefits out there for those of us that are on Medicare, so make sure you're making the most of it so you can get a lot more miles out of that chassis.
Yeah, absolutely.
All right, Dr. Neal, anything else before we let you go?
No, okay, just to recap, we talked like 2 weeks ago the annual wellness on that. That just set us up really well for a big visit that's usually about an hour long. And then we got, after that was the pulse, which is the physician's order for life-sustaining treatment. I think you and I did that pretty well. And then this is the last adjunct because that's setting you up to have a personal care manager because that is a really nice tool to make sure that if you need anything, because sometimes you may not necessarily need the provider, you just need someone to answer some questions or just need a little adjunct to your day and your health management, which they usually do a really, really good job. And then you're in life plan. Okay. Yep.
All right. Can you give us a little teaser of what we're going to be talking about next week?
Well, the sad thing is I didn't know.
Do you know yet?
I didn't know I was on next week.
Okay, then. All right. I don't know either. They don't tell us anything.
Coming attractions. I didn't know.
All right. Well, Dr. Neal, thank you so much. Again, the number is 648-9110. Call that, get your annual wellness, and also get a case manager set up so you
Absolutely.
can keep on making the most out of this. So, Doctor, again, thank you very much.
Well, it's a good way to start a new year. Absolutely.
It is. We're off to a good start, so let's keep the momentum. All right, thank you very much. Jason, Vic, I believe we are going to take a break now, or what do we got going on?
Yeah, we're going to take a real quick break, and then we're going